everybody, so I'm here to do my 13 and 14 week update, and I wanted to do it before it got too late because I realized I'm already in my 15th week. So I didn't do an update for week 13 because it was pretty much similar to week 14. All the symptoms and everything are the same, basically. Nothing has changed. Not even the belly is changing. It's pretty much staying the same for the past 2 or 3 weeks. So just a really quick 13-week update. I'm still feeling the morning sickness, and I'm still feeling pretty tired. I tend to sleep a lot in the first trimester, and I'm hoping that I'll be getting my energy back pretty soon because being tired and pregnant and having a 4-year-old can be pretty hectic. So I'm hoping that I get my energy levels back pretty soon. I also lowered the dose of Declectin that I was prescribed by my doctor for the morning sickness because it's not as bad as it was before, and I can sort of manage without the prescription, but it's sort of at its worst in the evenings, and that's usually when I tend to take it. I take one pill in the afternoon, and it sort of helps my appetite in the evening so that I'm not super nauseous, and so that I am able to eat without, feeling really sick. And so I've lowered my dose from taking 4 pills a day to taking 1 pill a day. I just wanted to eliminate any medication that's unnecessary, and I am managing my morning sickness pretty well. So I was hoping that lowering the dose of Declectin would also lower my fatigue, but it's pretty much the same. Baby's taking all of my energy, and I do what I can when I can. I take a nap when I can, and I'm just very thankful that Madison is in school, although it's been spring break for the past 2 weeks, so she's been home with me. But I'm thankful that she's in school, and she's pretty much busy most of the day. So week 13 was fairly uneventful. Week 14 was pretty much the same, taking 1 pill a day. Still pretty tired. I've been feeling a lot of round ligament pain, like stretching and pulling around my uterus. The baby should be about the size of an avocado, about 3 to 3.5 inches. At my last ultrasound, which was between 8 and 9 weeks, the baby measured 4 days behind, so that's why my weeks turn over on Wednesdays now instead of Saturdays. So my due date, instead of September 20th, is now September 23rd. So that kind of put me in an awkward position a couple of weeks ago where I was behind. I was a bit behind than where I thought I was. So I'm not sure if that makes any sense at all. So I've sort of been getting my energy back. I've been doing a lot of spring cleaning the past few days, the past week or so. Week 14 was pretty much the same as week 13. Nothing really has been changed. Although 14 weeks and 1 day pregnant, which was on, oh no, sorry, that's 13 weeks. The last day before I turned 14 weeks, so on Tuesday, I had a pretty scary situation happen to me, and I actually had to go to the emergency room. I'll make this short because I don't want this to be a really long video, but we had just finished eating dinner. I cooked pork chops and mashed potatoes for dinner, and we had an early dinner because we had language class later that evening. So after I ate dinner, I was getting ready to go to the language class, and I was in the washroom brushing my teeth, and brushing my teeth made me gag, which caused me to vomit all of my dinner and everything that I had eaten prior to that. So everything that I had consumed in those last few hours before that happened sort of all came up at once, and it was quite a bit of food, and it came really fast, and there was a lot of it, and right after all of the food was emptied out of my stomach, a lot of blood came up as well. I threw up a few times, and most of it was just blood. And that had never happened to me before, and I was really scared, and I didn't know what to do. I didn't know what it could be the cause of. So I immediately got on the phone with my mother. Actually, I tried to call her, but she didn't answer. So I called my dad, and he didn't answer either. So I called my sister, and I told her what happened. She's like, it sounds like you need to go to the emergency room. So she's like, maybe call the nurses' helpline, and they can tell you what to do. So I got on the phone with a nurse, and she tried to get a hold of my parents. And the nurse did tell me that if it is a couple of tablespoons or more of blood, then it is something to be concerned about, and that I should go to the emergency room. So that's exactly what we did. Zachary took me over to the emergency room. My parents met me there, and they took Madison for the night, which, thank God, because I didn't want her to be in the emergency room with a bunch of sick people. There were coughing people everywhere. I didn't even want to be there, but I had to. So we got to the emergency room. I told them my situation. They checked my my blood pressure, which was fine, and my heart rate, which was, I think those are the same things. So everything was fine, and they ran some blood tests to check my, I think he said he was checking my hemoglobin levels, and that came back fine. I guess that's just to make sure that I wasn't bleeding internally, more so than what I had vomited. So I was really scared. I didn't know what was happening, what was going on. So they hooked me up to an IV just to make sure that I didn't dehydrate. So I had to stay in the emergency for about an hour and a half. And so they put me on an IV, and they gave me Gravol for the morning sickness, sort of like the queasiness, because they didn't want me to throw up again. So they gave me that, and near the end of the ER visit, he came in and he told me that it was a gastrointestinal bleeding, meaning that I had vomited so much at once, and I had never done that before, recently at least, that it stretched the lining in either my stomach or my esophagus, and ruptured one of the blood vessels. So I was like, that's really scary. What can I do about it without, harming my baby or my pregnancy? And he's like, he said that ruptured blood vessels are pretty benign, and it'll go away on its own without any intervention. So I was very thankful for that. He gave me a prescription of, I think, Zantac, which I thought was really weird because I thought Zantac was for like heartburn or something. But anyway, I have to take one pill every day for the next 2 weeks, and he recommended that I go see my OB just to check on the baby, make sure everything's okay. So I'm planning on going to see her tomorrow or on Monday because, oh no, she doesn't work on Monday. But I'm going to see her pretty soon just to make sure that everything's fine. They did do an ultrasound, which I was really happy about. I did ask one of the nurses if she can check on the baby just using the fetal Doppler. She's like, no, I'm not going to do that, but the doctor might. And then she just left the room, and I was like, well, I don't understand why she couldn't do it. But the doctor came in and he did an ultrasound, which I was not expecting. So I'm very thankful that he did. And it was actually Zachary's first time seeing the baby, and the baby was absolutely fine. He had a normal heartbeat, and the baby kicked and moved around a little bit, so I was really happy to see that. I didn't get a picture, unfortunately, because it was the emergency room, but I'm hoping to get one in a couple of weeks. So yeah, that's pretty much it. He said that if it happens again, then I have to go back, and I'm really hoping that it doesn't. My morning sickness honestly hasn't been that bad lately. I've just been vomiting at least once a week, usually in the morning when my stomach is empty, so it's mostly water. And this is the first time in a long time that I've actually thrown up any food, so I guess that's kind of what caused the internal bleeding. So everything's fine. I feel totally fine. I feel normal. I don't have any unusual side effects from the medication. He just recommended that I eat smaller portions of food more frequently, and I told him that I wasn't taking the recommended dose of Declectin just because I felt like my body didn't need that much. And he said, well, we don't want you to get sick over the next week or so maybe up your dose. So I'm probably going to end up taking 1 pill in the morning, 1 pill in the afternoon, just to kind of help me eat and keep my food down during the day. Even though I don't feel like I need it, I just don't want to take that risk. So that's it for this update. Probably no changes in the belly, so I'm not gonna show that this week. Maybe in the next video I'll show it. But yeah, everything else is going great. There's nothing else to update on. Gonna go see my doctor, maybe get another ultrasound, hopefully, if she feels the need to. But yeah, that's it for this week. And thank you guys for watching and subscribing and for leaving wonderful comments. I really enjoy talking to all of you ladies. So thank you so much for watching, and I'll see you in my next video. Bye.